Welcome back to the second conversation of this series on sickle cell in pregnancy. Now, we will discuss the pathophysiology of sickle cell disease and its clinical presentation.
As we have discussed in the previous conversation that in the sickle cell disease, the shape of RBCs gets changed from normal biconcave to crescent or sickle-shaped due to lack of oxygen in abnormal hemoglobin. These cells, because of their altered shape and stickiness, block the flow in blood vessels, leading to temporary or permanent organ dysfunction or structural changes.
Absolutely. So, what are the precipitating factors that trigger the sickling process?
Okay, these precipitating factors are infections, acidosis, dehydration, hypoxia, overexertion, and even cooling or exposure to cold temperatures.
Okay, a lot to consider. So, can you elaborate a little bit on how each of those factors that you just listed specifically trigger sickling?
Sure, when the body fights an infection, it consumes more oxygen, potentially leading to hypoxia, which is low oxygen levels. This hypoxia triggers the sickling process.
Interesting.
Acidosis, an increase in blood acidity, can reduce hemoglobin's affinity for oxygen and promote sickling. Dehydration decreases blood volume, concentrates the blood, and increases viscosity, raising the likelihood of blockages. Overexertion increases oxygen demand and can contribute to dehydration. Additionally, cold temperatures can cause vasoconstriction, reducing blood flow and potentially triggering sickling.
It's like a cascade of events that lead to this. Very interesting. Let's move on to the clinical presentation. What are the common signs and symptoms of sickle cell disease?
Okay, so the signs and symptoms of sickle cell disease, they can actually vary quite widely from person to person and they can be quite diverse. Some individuals might have mild symptoms, while others experience severe and really debilitating episodes. But it's important to remember that the symptoms often stem from either the anemia itself or from the complications of something called vaso-occlusive crisis.
Okay. So can you elaborate a little bit on the specific symptoms related to each of those categories that you just mentioned?
So, a reduction in the number of red blood cells leads to common symptoms like weakness, fatigue, pale skin, shortness of breath. And so those are directly related to the body's capacity to carry oxygen because of the shortage of healthy red blood cells. On the other hand, vaso-occlusive crises, which are caused by the blockages in the blood vessels due to the sickle cells. They often present with sudden and severe pain, and this pain is often described as sharp, stabbing, throbbing, and commonly affects the joints, the abdomen, the chest, and back.
So those are kind of the hallmark presentations of this disease. Are there any other signs or symptoms that we should be aware of?
Yeah, there are a few. So, jaundice, which is the yellowing of the skin and eyes, it's due to the breakdown of red blood cells. That's another common sign. And also, patients with sickle cell anemia are more susceptible to infections because of damage to the spleen, which plays a vital role in the immune system. And it's essential to remember that repeated crises can lead to long-term damage to various organs, including the lungs, kidneys, heart, and brain. And this can lead to, a wide range of complications, including things like acute chest syndrome, strokes, gallstones, leg ulcers, pulmonary hypertension, among others.
Wow, that paints a rather alarming picture of the potential complications. So early diagnosis and management are clearly crucial here.
Absolutely.
So, let's conclude this session here. In this conversation, we talked about the pathophysiology and the clinical presentation of sickle cell disease.
In the third part of this series, we will discuss about the screening and diagnosis and the importance of preconceptional as well as prenatal counseling. So goodbye for now and stay tuned.